Hey everyone, there's a bunch of people coming in through the weight room right now, but welcome. This is one of my favorite events of the year, probably my top two events of the year, which is called First Look. It's the chance that we get to kind of show off to the public all the great companies that we have added to the Jumpstart Foundry portfolio over the last year. And it's always a lot of fun. Of course, Jessica Goodwin and I are here from the Jumpstart team. I'll introduce our roles and things as we get started. But we've been working with these founders and these companies for, in some cases, 3 or 4 months, in some cases, 9 to 10 months. And I'm really impressed with the quality of work they're doing and how much progress they've made so far. I think you will be too. So I'm going to stop sort of getting out of the way, and we'll get to them as quickly as we can. I'm just going to give you some quick introductory comments first. So, again, this is First Look. It is all the companies we invested in 2025, and they've got their feet under them now, and they're ready to show you how great they are and what they're doing. And at the end, they will each have an ask. Maybe they're raising money, maybe they're expanding their customer base, maybe they're hiring people. And then if you're interested in learning more, there'll be a great opportunity. We're going to have about 45 minutes or so of kind of telling you what these companies are like, giving you some background. They'll each have 3 minutes. But then we're going to have an hour where you can go into a breakout room and really talk to the founder. Maybe you want to learn a little bit because you're an angel investor and you might want to invest. Maybe you're a customer that runs a health practice or runs an employer group and wants to utilize one of these tools. It's going to be pretty informal in the breakout groups, and they'll be able to go into any detail you want about their company and all the information. So with that, again, I'm Vic Gatto. I'm just going to give you a quick little introduction. We're Jumpstart Foundry. We're one of the nation's leading, most active, best healthcare innovation funds. Of course, I'm completely biased in that. I'm Vic Gatto. I'm co-founder. Marcus Whitney and I started Jumpstart 11 years ago, which is a long time. And I'm also chief investment officer. And then Jessica Goodwin is helping me. She's chief of staff here, which means she kind of runs everything. Keep going, next one. And so we are now, we just closed applications for Q1 and we're in the evaluation process. But we are accepting applications for Q2. So the deal is you fill out a form online. We collect the same information from all of the companies, so it's completely fair. And then we evaluate those applications, and we have a standard investment. So everyone here today, everyone in Jumpstart Foundry got $150,000 at a $2 million post-money safe valuation. And that way, that allows us to more quickly make investments without having to negotiate back and forth about the terms. We also are open for new investments. And so you can go to our website, which is jumpstartfoundryjsf.co. And there's a button literally on there that says I'm interested in investing. It's a great way to invest as little as $15,000 across sort of a portfolio of emerging, really exciting assets in healthcare innovation. And we only invest this 1 year, so we're doing 2026 right now. So you kind of get a cross section or an index of all the best startups in that year. And then over 3, 4, 5 years, they mature and develop and grow into some of the best healthcare companies in the country. Yeah. So before we begin, please turn your microphone off. We will have, like I said, we'll have time at the end for one-on-one or small group questions. But these entrepreneurs, these founders have really carefully mapped out how they're going to use their 3 minutes. So please don't interrupt them. It is useful to keep your video on. It helps the founders to see some faces. They can understand someone might be looking a little confused or might be smiling it helps with the delivery if you leave your camera on. So I'd appreciate that. We'll have 40 minutes. We're going to hear 11 pitches. They have 3 minutes each, and I'm droning on for probably 5 or 7 minutes. And then after that, we'll again have these breakout rooms. And if you're interested in networking, just recall the company's name. That's all you're going to need to know which breakout room to go to. And Jess and I will both be helping too, helping you navigate to find the right place. And just save questions, maybe write them down or remember them. These founders, we've been practicing with them over the last couple of weeks. They're super excited to really engage with you. So no question is not a good question. They want to hear what you're asking, and it'll be really fun, I think, for them and for you. So with that, let's get started. We have Antelope Recovery, and Shelby is going to lead us off. Go ahead, Shelby. The mic is yours.
All right. Thank you, Vic. Great to be here. So I'm Shelby Robbins, founder, CEO of Antelope Recovery. We do teen intensive outpatient care delivery at scale. And next. So the problem is there is a teen mental health crisis, and existing healthcare services are failing to address that crisis. So I can bring your attention to that 10% number. That is a stat from the CDC. They're reporting 10% of teenagers in the US had an attempted suicide in 2023. Great. So a big reason that we believe that existing services are failing to address this problem is they are failing to reach rural youth. We launched our program in Colorado. This is a map of Colorado with dots where all the mental health programs that exist are. You can see down at the bottom, Las Animas County is as big as Connecticut, and there is not a single mental health program in that county. So at Antelope Recovery, our goal is to bring mental health services into rural markets. We believe for teenagers, the missing link in care is intensive outpatient care. So what that is a type of care for kids who need more than 1 hour of therapy per week. That 1 hour of therapy is very unlikely to help that teenager make any progress. However, we don't want to take that teen out of their home or out of school or out of work. We want to keep them in their environment, but they're needing about 15 hours of care a week. The reason there are not a lot of intensive outpatient programs is the logistics and compliance complications are super challenging. So we brought on Steven, our CTO. He's been building out our tech backend so that we can deliver this level of care to youth at scale. So traction to date over the last year, we've made $900K in client revenue alone. Since opening in 2022, we've raised $700K in non-dilutive grant contract revenue. We're in network with all major insurers. Medicaid is our largest payer. It's about 60% of our clients are Medicaid. And then 60% of all of our referrals are from the justice system. So we've learned that if you want to reach people in rural USA, getting in touch with police officers, probation officers, sheriffs, those are the people who know who the teens are that are struggling in those areas. So that's where most of our partnership development is happening. So we are raising a small pre-seed right now. We are seeking a lead at the moment. Most of that funding will go into tech, product, clinical ops development, and then a small amount of that will go to more go-to-market experiments. So thank you. It's great to share. That's my contact info. I'd love to connect with any of y'all after this. Oh, Vic, you're muted.
Okay, I was saying all these nice things about you, Shelby. Really excited to be part of Antelope. Really important space. Okay, we will go to Matt for Boom AI next.
Good morning, everyone. My name is Matthew, and I'm going to go straight into it. Every year, universities lose millions in tuition, not because students failed, but because they quietly fall apart mentally and nobody caught them in time. I'm Matthew West. I'm a licensed school psychologist with 15 years. We're working with students that have been in crisis at the collegiate level. I built Boom AI because I got tired of interventions coming in too late. The biggest problem that we're faced with now is mental health is the number one driver of student dropout. 40% of students consider leaving because of the mental health that they're faced with. Each dropout costs a university $50,000 or more, and 1 in 3 students never touch campus counseling because of the wait list. Universities have no real-time visibility in student well-being until it's too late. The solution that we're providing is a retention operating system for higher education. Students get daily mood check-ins, peer support, and AI-powered wellness nudges. Universities get real-time retention risk, AI crisis detection, and compliance-ready analytics. So we're combining business intelligence with mental well-being intelligence. And we integrate that directly into the learning management systems that we are going to partner with, for example, Canva. We don't just support students, we protect university dollars. How it works is students check in, there's an AI that detects risk, peer support is activated, admins get alerted, and students stay enrolled. The traction that we're currently in process is we have 1.1 ARR. We have over 100,000 students with 11 partnerships that are paying. We have 91.8 retention rate that are renewing every year, and with 3x year over year. We have zero paid acquisition. It's all outbound and through my network of people that I've known. And we have an 82% gross margin, 50 to 1 LTV to CAC, so cost for acquisition. Universities are not renewing because it's a nice to have. This is a must. This is a need that is currently a big problem, and they see it and they see the return on investment. And they have the budgets in order to allocate for this infrastructure to be put in place. The market right now, the TAM is 12 billion. Our LMSO, Learning Management System Integration Strategy, gives us a direct distribution point or path with over 6,000 institutions. And that partnership that we're in talks with Canva is going to allow us to further our distribution, and no one else is positioned in this way. Right now, our business model is we're charging the universities around, on average, 100,000 per year. And it's locked into budget. So it is on a cynical. So right now they're budgeting for the fall. So right now we have colleges in the pipeline, and we're focusing on locking those contracts in for the fall. Our team is built around engineers and myself. I'm a psychologist, so I know firsthand what kids are experiencing, and then also on the admin side. So we know how to scale based on the tech side of the engineers that we put in place. They have backgrounds in ed tech. We are transitioning to move our team in-house. So that's something that we have a team in overseas right now, but we're planning to move in-house. And that's part of the ask and the reason why we're raising 3 million. We want to put 40% into the sales and LMC distribution through Canva. We want to put 30% into the AI in production and bring the tech team in-house into the United States. And then 20% will be towards customer success. So making sure that we're continuing to retain our current clients. And then 10% is operations and compliance. So this will get us 4 million ARR in the next 18 months in a clear path to raise our seed series A. So that's the ask. We're on track. We have traction, the model and the distribution path. We just need the fuel to become the standard. And if there's anything I can answer at this time, I'm happy to do so.
Well, let's hold it for the breakout rooms. But thank you, Matthew. That was great. Great
Okay, perfect.
story. So we have 2 behavioral health so far. Let's shift now to Circadify, and Ryan will tell us about Circadify.
Yeah, hey everybody, my name is Ryan. I'm the CEO and founder of Circadify. I'm currently leading our go-to-market strategy and building the core applications surrounding our AI tech. And Yihong is writing our proprietary algorithms and training our core models. In short, what we do is we capture a 30-second video of your face, and we turn this into clinical-grade heart rate, blood pressure, blood oxygen, and more using nothing but any common phone or laptop camera. This is incredibly new technology powered by the acceleration in AI training capabilities over the past 18 months. But even in this early state, there's an incredible opportunity to start improving care today, beginning with telemedicine. Since COVID-19, over 75% of hospitals and clinics are utilizing telehealth for patient visits. But because of the remote nature of telemedicine, care teams cannot execute the fundamentals of a thorough exam or procedure. Most notably, the first step to every in-person encounter is missing: the vitals collection process. The AMA notes that less than 10% of telehealth encounters actually involve the patient checking their vitals, and less than half of Americans even own a blood pressure cuff or a pulse oximeter to track their health remotely. There's a clear problem. Providers are making decisions without data, and decision making without data is guesswork, and guesswork has no place in the field of medicine. So we built Circadify to fix this, and we've made it incredibly easy for both the patient and the provider. On the patient end, they simply open our web app on their smartphone or computer camera, complete a 30-second face scan, and we break down extremely small color changes in their face correlated to blood flow, send that to our AI model, and done. And the patient gets a report of their vitals in less than 30 seconds. And I've talked to multiple care teams in different specialties, and they all ask the same two questions. And the first question is legal. How does this work from a regulatory standpoint? So fortunately, major wearables brands have already carved a clear outline for what can and cannot be said in the space. And recently, the FDA has further relaxed rhetoric around certain consumer digital health technologies. And secondly, folks ask us, how accurate is it? And we've seen some incredible results in our latest model. We've achieved performance comparable to popular health wearables that cost hundreds of dollars. And this will only continue to improve as we fine tune and we are able to purchase and train on new data. So right now we're ready to go to market. We've built Streamline to scale and ready to integrate with teams of any size, handling any volumes of telehealth visits per month. We've made great integration so simple that physicians of any technical level can add it to their telehealth workflow in 15 minutes for less. And our big ask is that we ask for warm intros to physicians and providers practicing the space, particularly seeing any volume of telehealth visits.
Great. Thanks, Ryan. And if you want to learn more or see it in action, join the breakout group and Ryan can walk through that with you. Okay, so next we're going to go to another provider tool called DocTalk, and Ollie will help us understand that.
Thank you, Vic. Hi, everyone. I'm Ollie, CEO of DocTalk, where we use AI to simplify healthcare for both providers and patients. Before founding DocTalk, I spent 7 years as a venture capitalist and kept coming up with the same problems as an investor, making people healthier. So I spent months in New York City talking to low-income families and physicians who serve them, and that's how I came face to face with America's primary care crisis. I met Maria outside of an FQHC in the Bronx in the morning, who was waiting just to get her patient records to be referred to a specialist. And I met Dr. Neil, who wanted to spend more time with his patients, but just spent too much time on paperwork, billing, and administrative tasks that left him with no time in a day. After dozens of interviews, it became clear that patients lacked access and physicians lacked capacity. After we zoomed out and did more research, the AMA reports that we have a shortage of over 40,000 primary care physicians, but yet those doctors spend over 70% of their time on administrative tasks. And so we asked, what if technology could give doctors their time back? If we could free up physicians, patients gain access, and a $30 billion opportunities and efficiency is unlocked. That's why we built DocTalk, an all-in-one AI-powered platform that automates every part of a provider's workflow. Doctors can market their practice, onboard patients, and automate charting, diagnosis support, and billing, while patients can connect and consult with licensed physicians anytime, anywhere, closing the access gap and improving quality care. Doctors can launch their own DocTalk portal, a custom practice page with automated marketing, AI-driven intake and triage, and streamlined record keeping and billing to keep everything within compliance and seamless. It's like having a full digital operations team powered by AI, so practitioners can focus on what they do best, treating patients. We've already seen great early success. Dr. Neil, one of our first doctors, had his increase of revenue reach over 30% after joining DocTalk, and he loved us so much that he joined us as a health director. To date, DocTalk has generated over $2 million in additional revenue for our providers, including physicians from Harvard Medical School, federally qualified health clinics, and mission-driven clinics such as the Lighthouse Group in Virginia that we just signed up. We're already at 160K ARR and climbing since we joined Jumpstart, jumping MRR from 4.5K to 12.5K year over year with an efficient model. Our team has a footprint that spans 9 states with providers licensed and onboarded in all 50 states. Our leadership team includes Jerry from a team that was acquired by WebMD, Brian, who built health systems for NGOs across the country, and a dedicated group of young professionals who train our AI models and help us go to market. And me with 7 years of VC experience and also experience of being CFO of a profitable YC and Sequoia-backed fintech company of over 100 employees. Our mission is simple: to give doctors their time back and restore equitable access to care. To date, over 1,500 physicians have joined our network, and we'd love to help you serve more patients if you're a physician. And if you're an investor, we'd invite you to join our $1 million seed round. Thank you.
Great. Thanks, Ollie. Next, we have Lab Simplified, and Pradeep will tell us about that.
Thank you, Vic. Hello, everyone. My name is Pradeep Pandari. I'm one of the founders of Lab Simplified. At Lab Simplified, we are in a mission to digitize the laboratories that are essential part of our healthcare system. To understand in a nutshell, we are doing what QuickBooks did for the small businesses by moving away from the manual systems to more digital end-to-end system to eliminate all the inefficiencies that happen in the laboratories. The story of Lab Simplified really started with my co-founder, who is a medical laboratory scientist who worked both here in US and in Europe. There was a common theme that all laboratories were doing things manually. It's hard to believe in the era of AI. Most of the day-to-day activities in the lab happens in the paper or in the spreadsheets. So we decided to do something about it, and we built Lab Simplified. This is a real picture of one of the top 5 children's laboratory here in US. What they are doing is they are manually jotting down the antibodies that they receive in the lab, manually tracking lot number, expiration date, and performing count daily to stay up to date with their antibody counts. So this is happening at one of the top 5 laboratories in the world, but same is the story across the board, across all laboratories in the world. So we decided to do something about it. We built a platform that brings together all the day-to-day manual activities that laboratories perform and give them real-time visibility into their inventory and their maintenance records, provide them operational control, accountability, and always keep them audit ready. So there are over 250,000 CLIA certified laboratories here in US, and the total number is projected to reach close to 5 million by the end of decade. So this presents a massive opportunity for Lab Simplified. So why now? So post-COVID, there is a massive demographic shift that is happening in the laboratory industry, and less newer students are going into the laboratory field as a result. But at the same time, the demand for the laboratory test is continuing to go up because people are taking control of their health and their lab results. So more and more laboratories are opening up, and there is a pressure for laboratories to do more with less people. So there is a clear demand for the tools to digitize and create the more efficiency in the lab. It is a great time for Lab Simplified to be in this market. And we are already validated by the industry leaders such as Northwestern University and Sonic Healthcare Laboratory. They have provided great feedbacks, and we also have some of the biggest laboratories in our pipeline currently. So we are currently raising a 500K round to close our sales pipeline that includes laboratories at major health systems and big private laboratories. Please join us in our mission, and please join my breakout room if you have any other questions. Thank you.
Great. Thank you, Pradeep. So hopefully you're starting to see a wide variety. There's lots of places that we can bring innovation to help in healthcare. And we have Kay next to talk about Lanyard in the credentialing space.
Thank you, Vic. Hi, everyone. My name is Kay, and I'm the founder of Lanyard Health. I've spent over 15 years helping healthcare providers get paid by insurance companies. I've seen how this process determines whether a provider can actually get paid. That's the experience, and that's why I started Lanyard Health. Imagine working for 6 months, not getting paid, or imagine moving your family for a role, opening your doors, hiring staff, and then being told you cannot bill insurance for half a year. And it's not because you didn't show up, but because paperwork is sitting in a queue somewhere. What I just described is called credentialing. It is a revenue and access problem hiding behind paperwork. Over 1 million providers are affected by the credentialing process. Practices can lose hundreds of thousands of dollars per month while waiting to be approved. It's still antiquated, running on emails, spreadsheets, and follow-up calls that may or may not get returned. The system that controls when healthcare providers get paid is still largely manual. That's why we built Lanyard Health. We're an AI-powered credentialing platform that combines smart automation with experienced specialists to get providers enrolled and paid faster. We call it credentialing as a service. We run the workflows, manage payer follow-ups, and use automation to reduce repetitive errors and prevent delays. Providers want transparency, and we give it to them. We reached $250,000 in annual recurring revenue. We've processed over 200 applications, and we've onboarded more than 40 small to mid-sized practices. Today, we're scaling credentialing. Next, we're building provider profiles so data doesn't have to be re-entered every time a provider changes roles or joins a new network. Long-term, we become the API and data platform that allows verified provider data to move across payers, EHRs, and health systems. I bring 15 years of credentialing and compliance experience. Our board includes seasoned healthcare and venture leaders, along with clinicians who have personally lived through credentialing delays. We know and understand this problem with our eyes closed. We are raising a $1 million seed round to scale our operations, expand capacity, and accelerate the build-out of our provider data layer and API platform. Credentialing determines who gets paid in healthcare. It's slow and it's fragmented. We're building the infrastructure that makes it faster. Thank you all.
Great. Thank you, Kay. Next, we have NutraRx, and Taylor will talk to us about that.
Hi, my name is Taylor Johnston, and I'm the founder of NutraRx. Next slide. Meet my son, Dash. In March of 2024, he went into acute kidney failure. It was this exact picture, realizing his eyes were swelling shut, that sent us rushing to Arkansas Children's Hospital, where we spent the next year and a half with 9 hospital readmissions. On the right is my Mimi. A month after Dash was admitted, she fell and broke the entire left side of her body from her shoulder to her ankle. Mimi has 7 different caregivers. Inside the hospital, EHRs keep care teams aligned, but the moment discharge happens, that coordination disappears and families are sent home with verbal instructions and a stack of papers. According to the CDC, there are over 100 million family caregivers in the United States, enough to fill nearly 1,500 NFL stadiums. That population is accelerating. The 65 plus demographic will grow by roughly 35% over the next decade, increasing pressure on the sandwich generation caring for both children and aging parents. 1 in 3 households already includes a caregiver, and through better home care coordination alone, we could reduce readmissions by up to 25%. This isn't niche, it's missing healthcare infrastructure. And here's where it breaks. Coordinated care stops at discharge. Nutrition isn't tracked correctly, communication breaks down, schedules become chaotic. Everyone is responsible, but which group text thread does it live in? And that's why we built NutraRx, a digital command center for caregivers. Our patent-pending algorithm filters out the noise and focuses only on the nutrition that matters. We combine nutrition, care tracking, and task-based scheduling into one secure system. Caregivers and clinicians don't need more data, they need the right data. Today, caregivers stitch together fragmented tools, food apps, messaging apps, calendars, medication reminders, none designed for medically complex care. NutraRx replaces that patchwork with a coordinated platform, one unified system. Care is organized into care pods. For families, that's $20 per month or $160 annually. Health system sponsor pods at $10 per month. Together, that represents a $3 billion plus annual opportunity. We've secured $150,000 in early stage capital. Our product is built with App Store submission underway and over 80 caregivers on our list. State pilot planning is in its final stages with active discussions across rural and tribal communities and paid provider pilots launched next. In exciting news, we've also been approached by a Shark Tank-backed, nationally distributed food access company serving over 2 million households on the Eastern Seaboard, who is very excited to pilot with us. At this time, our ask is introductions to rural health state leaders and rural health clinics. Next slide. Thank you. My name is Taylor, and I'm excited to meet with you.
Great. Thanks, Taylor. It's a big problem, big opportunity. Okay, next we have Nikki with Previse AI. Nikki?
Hi, everyone. My name is Nikki, and I'm the CEO of Previse AI. And our mission is to prevent avoidable complications in cancer care. Cancer commonly spreads to the spine, replacing hard bone with soft tumor. So you'll have patients who are completely fine one week, and the next they're in excruciating back pain, and their family is rushing them to the ER because they picked up their child. At that point, it's too late. They've already had a spinal fracture. Our co-founder, Dr. Flores, would treat these patients firsthand, admitting them for pain management or surgery, but a lot of these patients would leave, unable to walk, and because of delays to their cancer therapy, their risk of death doubled, and so many of them would pass away only a few months later. Today, there's no reliable way to predict spinal fractures in cancer patients, and the current standard of care only identifies 16% of high-risk patients. Now, the good news is that the data we need already exists. Cancer patients are coming in every 2 to 3 months routinely to receive CT scans that monitor their progression. Our software analyzes those scans and identifies vertebrae at high risk of fracture. And we do this so that we can then alert clinicians so they can offer early intervention, which can be as simple as medication. We've partnered with leading cancer centers such as MD Anderson for both pilots as well as to redefine clinical guidelines. Now, our target customers are the 65 NCI designated cancer centers, and it's because they capture 70% of our patient population. Now, if you take into account that patients are receiving around 10 scans on average per year and will be charging $300 per scan, you can see how our market size expands from a beachhead of $22 million to $25 billion globally as we expand our indications. Now, each of these cancer centers can expect a 2x ROI, and that's just based on reimbursement alone. Our core team is perfect for this because we bring a whole host of expertise across regulatory, clinical, and computer vision skill sets, which include launching oncology software in the space. You can see our advisors as well. We're backed by KOLs, industry advisors, including those that have successful exits in the radiology AI space. We're currently closing our $300,000 pre-seed round, and that'll take us through FDA 510(k) commercialization. So if you're interested in participating in this round as we close it out, or just learning more, then feel free to talk to us in our breakout room. Thank you.
Great. Thanks, Nikki. Huge problem and huge opportunity to help a lot of patients. So next we have Quiller, and Akash will tell us about that.
Hi, everyone. I'm Dr. Akash, co-founder and CEO of Quiller. We are building an AI agent team for radiology departments that increases their efficiency and revenue. My co-founder, Uday, who is an experienced software engineer, handles the development. He has multiple patents to his name and previously founded an app development company with over 30 employees. I'm a board-certified radiologist with multinational work experience. I design the product roadmap and lead sales and partnerships. This is our second venture together, after previously having built a popular breast cancer diagnosis app as a team. The problem that we are solving is that radiology workflow is very inefficient, which leads to overburdening of already short-staffed radiologists and huge losses in revenue to the hospital due to less number of reports that are produced. Over 50% of a radiologist's time is wasted on non-clinical tasks like typing and editing reports, switching between scan analysis and reporting screen, patient history lookup, and much more. We solve this problem by providing an AI companion that lets the radiologist focus only on the scan analysis and complete every other task by simply asking a platform in a natural language. This leads to 3 times faster reporting and up to 40% increase in revenue, since the remuneration of a radiologist is directly tied to the number of reports they can produce. Since our launch 8 months ago, we have gained over 200 paid users across 8 countries, resulting in an estimated annual revenue of $65,000. Over 1 million radiology reports have already been made on the platform. We are now ramping up our B2B distribution by partnering with multiple radiology software providers. This will give us access and visibility to tens of thousands of users versus our current few hundred users. We have pilots running with 2 hospital chains. We are more economical and much more feature-rich than our competition. One of our competitors, Nuance, was acquired by Microsoft for $20 billion. And our other competitor, Radii, is currently valued at $500 million. Our current Wedge product is an AI reporting platform, but we soon plan to expand it into a full agentic team that connects deeper into the hospital information system for even more capabilities like billing integration, report dispatch, auto comparison of previous reports, and much more, which today requires a large hospital staff to execute. Our current offering is at a monthly subscription of $79, and we plan to sell our full stack platform at $999 a month. We are raising $500,000 to reach 1.5 million in annual revenue in the next 18 months. Reaching just 1,500 users, even with our current lower priced offering, will achieve this target. And by the way, the global radiologist user base is 350,000 in number, giving us a market size of $4.2 billion, with 1/3 of this market being in India and in the US, where we have our strongest presence. You can find us on Quiller.ai or mail us on hello@quiller.ai. And I hope to see you all in the breakout room.
Great. Thanks, Akash. Excellent. Next, we have RFX Fitness, and Ryan will tell us about that.
Thanks, Vic. Hey, everyone. I'm the other Ryan. I founded RFX with a childhood friend of mine. We're a functional fitness company combining racket sports with group fitness. So the problem we're looking at is despite fitness and racket sports booming, there aren't any experiences that merge the two. So players are stuck with the typical group fitness experience like an Orange Theory or F45, which is weightlifting into endurance sports. Meanwhile, you have tens of thousands of racket sports facilities and hundreds of thousands of courts that are idle inventory they have a hard time keeping filled. So what we designed with some of the executives at companies like Orange Theory and F45 as a 60-minute group fitness class where the players are rotating through functional fitness and racket sports activities. So instead of treadmills and stationary bikes, they're playing tennis or pickleball led by a coach. It's a huge market and opportunity, as probably everyone has heard here. Racket sports is booming. If you want to go to the next slide, particularly pickleball and padel, as everyone's heard, but the tennis market is massive. We see 1 in 4 Americans signing up for gyms or group fitnesses over the past few years, and this is going to continue expanding while, again, there are more than 300,000 courts sitting idle. If you can go to the next slide. Our business model is probably our biggest advantage here. So we don't build the infrastructure ourselves. What we do is rent the courts from the facilities. We then pay our coaches and instructors to show up and run the class. The clubs will pay us an annual fee to be able to host these classes because we bring them in a completely new demographic. And then our biggest monetization is on the consumer side, where players will pay for class packs. They can pay for a class at a time or sign up. Where we are now is we're operating at 10 clubs across 8 cities, running a few classes a week. We make about $125 every single time a class is run. And we have 20 clubs on our wait list that, frankly, we just don't have the bandwidth to activate. So we're looking to raise $500,000 to make 2 hires. That's one on growth and one on operations. Actually, as of last night, we signed a partnership with a company called Court Reserve, which is the biggest club management software in North America. They have just over 2,000 clubs to be our distribution. So we're at a place here where we actually cannot keep up with the demand going forward. So we'd like the money to get to $1 million ARR in the next 12 months, and then more than double that over the next 18. If you'd like to talk to any of our clients or take a class, you can let me know in the breakout where you live, and I'll tell you if we've got one near you. Thanks for your time.
Great. Thanks, Ryan. Excellent. Okay, then next we have James with some Somaticode. Hopefully I said that right.
Yep. Thanks,
Okay.
Vic. Hi, everybody. I'm James Bradshaw, CSO of Somaticode. And at Somaticode, we're trying to transform the current state of healthcare from chronic disease and crisis management to preventative care. We've developed some saliva-based biometric tests that are affordable, actionable, and accessible. And we're moving healthcare from a reactive model to a proactive model. We believe that the most important conversation you have about your health shouldn't happen twice a year in a doctor's office. It should happen every day in the comfort of your daily routine. So as we look at the current reality, if you want to know what's happening inside your body today, you need a needle, clinical lab, and 2 weeks of waiting. It's expensive, slow, and some data changes so rapidly you can miss it with a one-time blood test. So Somaticode flips the script. We're providing biometric data in real time for the price of a cup of coffee. We aren't replacing the doctor. We're giving you the data to make that doctor's visit 10 times more effective. And so here's the hard truth. 90% of our 4.9 trillion healthcare spending is just us reacting to chronic disease and emergency crisis care, ignoring real-time biometrics associated with mental health, infection, inflammation, stress, and kidney function leads to chronic conditions that are costing us in the healthcare system money, time, and a reduction in the quality of life that we literally can't afford anymore. Somaticode's proactive model encourages repeat purchases, low-cost, high-frequency testing that can keep customers out of urgent and ER care and put them back into their daily lives. So our current traction and proof of concept is our mood sense test. For the 1.3 billion women in perimenopause globally, mood fluctuations aren't just in their head, it's in their chemistry. And by measuring SAMe metabolism, which influences mood, we give these women and their doctors real-time data to manage their constant emotional changes, improving their quality of life and helping to reduce larger costs that come from mental health management. Since launching MoodSense in late 2024, we've moved over 500 units and generated over 50,000 in revenue with B2B marketing averaging 4K MRR. So our tests are actionable biometrics for preventative care that could be used before the chronic disease state is reached. Crucially, we aren't diagnosing disease, we're providing biofeedback. You would never try to manage blood glucose levels with a single test that takes weeks to get results from. So these biometrics that we're testing equally fluctuate within a day and need real-time testing and daily monitoring to be useful for preventative care. And our customers use test data with their healthcare practitioners to see exactly how their lifestyle, diet, stress management, medications are actually affecting their internal chemistry. Our team has the experience and groundbreaking technology to make Somaticode a household name. We're moving healthcare from the hospital back to the human. And we're Somaticode, and we'd love to show you how we're making healthy a daily data point. We're now raising a 500,000 pre-seed round to fuel our 2026 expansion. This capital scale will scale our marketing and digital infrastructure, finalize validation for our next 4 tests, and lock in our IP. We aren't just building a product, we're building the future of preventative healthcare. And we'd love to chat with you more about the details in our breakout room coming up next.
Great. Thanks, James. Okay, so that is the 2025 portfolio. Hopefully you're as excited as I am. You see this wide variety, lots of diverse solutions, innovative solutions to real on-the-ground issues. And these companies are making an impact right now, but they need your help to grow, to get more customers, to get more capital, to learn more.